This is the marathon session. I'd like to get you out of here sooner rather than later. Okay, thank you. So my only last call on category 2 was whether or not someone wanted to follow up on item 49 to clarify that along the lines of Ken's question. Were we talking more about expanding supply countywide so that there's less focus on Everett, or was that really like reducing the concentration equals reducing capacity? So, and that's just a question, it's not a request. So that was the only thing that we didn't, I think, potentially speak to. Ed, is your sign up? Yes, go for it. It's not up. Okay. Hearing none, or Bob, you have something for category 2?
Yes, it was the point that Ed made is close to or relates to number 39. In 39, the idea was that we're making a lot of decisions or recommendations. There's a lot that we don't know about what the life is like on the street, and it relates very closely to what Ed was saying. Is there's a lack of important detail around what is the incidence of drug and alcohol abuse or mental illness, and it seems like that category could be modified to a number 39 to say, involving currently previous individuals for that impact, and gathering more detailed information from county or from providers, county services, whatever, as to help us better understand the situation on the streets.
So potentially that same item 39 as is, with additional text along the lines of, and gather more information about these individuals in this population. Is that Ed?
Yeah, thank you for that comment, because I think whether it's this item or another item, maybe it's simpler using an existing item, but that we can get the data so that we know and understand the nature and extent of the problem in terms of who's out on the streets and what kind of needs they have, because we're not going to help them find the right solutions unless we understand what the extent and nature of that need is. So a good outreach worker in 2 weeks, stay hanging out on the streets, getting to know every one of these guys, could figure out approximately how many of each of the different types of needs exist on the streets, so that we could tailor our recommendations, or the implementation plan could be tailored. So I don't know if this is where that request for data gathering initiative would go, or someplace else.
Seems as good as one as any. Would you be willing to second the proposal?
Yes.
Okay,
I'll second it.
Can you have a comment?
Not on that one. I want to go up after that.
Okay. All right, so we have a motion to amend item 39 to add words following the file lines and take other appropriate steps to gather additional information about these individuals. So, learning more about the homeless and talking to the homeless. That is the motion to expand item 39. Is there any further discussion? If not, I want to move quickly so we can get you out of here. All right, hands up for those in favor of expanding that item. And I think we still have all 3 people. I'm seeing 23 people. Thank you. No, I'm seeing 22 people. Okay, that will be moved up and will be supported with, it'll go to green and will be expanded. Okay, is there anything else? Ken, you had a comment. You cannot make a motion.
Yeah, mine was on 49, and if I really looked at 49, as I said earlier, if that said take steps to expand the concentration of alcohol, drug, mental health services outside the downtown Everett corridor, that would be a very different way of looking at it, and I think the votes would have been quite different. But I also think that, going back to Craig's comment earlier on the 26 versus 85, I think that you could actually incorporate all 3 of those into one and have some level of specificity that Craig's looking for. This group, outside of us bureaucrats who work for the government, who have the funding, This group is a task force, and what you're doing is recommending to the people who hold the purses, you're advocating, in other words, you as a group are going to advocate to the funders that we need more resources for those services, not just in the downtown corridor, but across the county. So somehow, I believe all three of those can be integrated and hopefully bumped up to the 60% or above.
All three of those being 49, which, and who?
49, 85, and what was that other one?
26.
Craig, was that 26?
Yep.
Okay, 26 is already in the green level. We'll come back to 85, unless somebody wants to make a motion right this minute. I think we'll come back to advocacy items. Ed?
In terms of specificity, I think also some clarification on what kind of mental health funding. I mean, there's various, marriage counseling, anxiety counseling, there's chronic mental illness. There are many levels of mental health and many types of funding, and to leave it as open as it is doesn't really get at the heart of the issue that we're talking about here.
I appreciate that comment, although that motion did just fail. So that was the last motion we took before the break. So I think we have to move on from that one. We may come back with more specificity later. Okay, so I think we are on category 3, providing more housing and shelter, and I think you guys all knocked off the big ones with some support. I think there are 2 items in this one that were notable to me. One, I was a little surprised by the rejection of the Housing First model, which was presented by several speakers as a best practice, and we sort of supported everything around that, but that phrase did not win support, so I think that is worthy of some discussion in the group. And the other thing which sort of surprised me, and it may be because of the way this item was written, in item 65, this is where the shipping containers and small housing options, small, less expensive approaches to housing comes up. And I thought I had heard you folks support that one before in discussion, so I was surprised that did not garner more support, item 65. Those were just my observations from this category. So with that opening, I'll open up for discussion on items in category 3. Yes, Ken?
I was just wondering whether there was any confusion by the folks voting on the shipping container versus 55, which is storage facilities, which storage facilities are really different than shipping containers.
Yeah, I don't think that was anybody thinking that was housing?
No.
Okay, I don't think that was the confusion.
Okay.
I thought it might have just been mushed together with so much stuff at item 65 that it may have gotten lost, or maybe folks just are not ready to see those things in the city, so any of the above could be true. Discussion or questions for anything here in category 3? If not, we will move forward and leave things to stand. Oh, there goes, okay, Mark, Chris.
Chris was first.
Okay, Chris, go for it.
Well,
Thank you for using your microphone. Folks are having trouble hearing, so.
I was also surprised by the housing first, because I don't know if people, from a labeling perspective, I was kind of thinking of it more as the Tacoma model is the one that was attractive to me. And I don't know if people voted against it because from a cost perspective, but the concern that I have right now is for some of the people who are on the street, we don't necessarily have anything in our tool bag that we're recommending that deal with people who are using alcohol, using drugs, and are on the street causing some of the problems. So I thought the model that was offered by Tacoma was really attractive when I voted for it, so I'd be curious why other people didn't. So.
Anyone have a perspective that they would be willing to share on why they didn't support that or had questions about it?
I didn't support it simply because at the time I was looking at the dollar signs and I thought it was a great model and I would support it, but I now hear today that the more thing is the focus is on pie in the sky, or
I would not say it quite that way. I think I said aspirational. We should
aspirations. So that's
ask
why I
for
didn't
what you
vote
think
for
would
it.
be a good solution, and
Only because I was worried about money.
that's a good observation. Glenn?
I don't think shipping containers are the most economic way of providing housing, and I'm disappointed that we didn't, because I think that's one of our biggest solutions. But let's don't go the way of Seattle if we ever do that, and vote out common kitchens. I heard a comment at a Rotary meeting just the other day that they were in Paris and there was hardly any street people, hardly any homeless. And I think it's got to be because they have housing for them.
So was that a comment in support of the Housing First item? Okay, Sylvia?
I just wanted to speak out in support of the Housing First model. In this description, unrestricted access to shelter. So I was curious as to whether combining shelter and housing, which are two very different solutions to chronically homeless, I don't think it's a good idea to add them to the shelter population. We really are talking about housing. So I'd love to amend this to take out the word shelter and just talk about housing.
So the motion would be to take out the word shelter and in item 62 and move to revote it with the idea of getting some consensus around it. Is there a second to that motion? Second. Who was that second? Thank you, Georgia D. Okay, is there any further discussion? Alan?
Well, I just want to point out that on at least that idea of housing first, 43% voted 3, which is in that middle ground. And I think that some that may have voted for or against or even in that middle were looking at dollar signs. And I think that in this category, the idea of what has been recommended or passed, especially number 57, really can be considered part of that. I know it's not specific, and I agree with Craig. There are some things in here that are very unspecific, but there are some items that are broad that allow for some of the things that didn't pass to potentially fit underneath that.
But when I agree with that, like when we present the housing things, they'll probably be consolidated somewhat. But at the same point, if we have a ballot that says we don't support the Housing First model, that's kind of a significant statement at this point. So we have a motion and a second. Is there further discussion? I'm sorry, Mark, yes.
I think it's really a money issue to me. When the gentleman from Seattle was here, and I don't remember the exact dollars, 75 people was $10 million or $8 million to build the housing, and he poo-pooed the container comment, and I don't think the container comment is strictly just a container. I mean, to me, I look at it as a low-cost housing, like a dorm room at a college. You know, my question is who is going to participate in that? Is it isolated to the problem people? Like was mentioned last week, and I don't remember the exact numbers, the one individual costs the city $500,000 a year, and they figure in a new program they're going to save $400,000. Well, where's the $400,000 savings going to go? Is it going to go to number 60, which is to make sure there's subsidized housing for children, the disabled, and the elderly? So my concern is the gospel mission provides services to a certain part of the population, and I'm just concerned about taking a lot of dollars to a limited number of individuals that choose a lifestyle of alcohol or drugs, and that's what they want to do, as opposed to putting it to people that, like at the mission, which many of them have jobs, they go work, they just don't have enough to live on their own, or family with children, or Compass Health, not Compass Health, Mind Block. Cocoon House. The services for those children to hopefully get them on the right foot so they don't end up like the people in Seattle.
So there's some tension there between addressing the needs of the chronic homeless population versus being concerned that by putting more funding in that direction, you're going to be taking money away from populations you would rather serve? There's a difference between chronic homeless, in my opinion, and people that choose to be alcoholics or drug addicts for the rest of their life. I believe, in part, that's what they're doing in Seattle, is they're just putting them all in one building. So you're skeptical
I realize
about that
there's people that
model.
are coming out of that system, but I'm just afraid that it's at the sacrifice of other programs.
Okay, got it. Okay, Julie, comment?
So I understand where you're coming from, but I have a slightly different view, because I believe that the cost to the community of not dealing with that is far greater than the cost of trying to help deal with that. So I am a proponent of housing first. I don't, even if we had some, it'd be more than we have now. But the cost that we're paying in and out of jail and in and out of hospitals is huge. And I agree with your priorities and where you're at with that, but I think we need to do it all if we can.
Okay, I think we got David, and then Bob, and then Glenn, and then Ken. Go ahead.
I think my comment mirrors Julie's, that when we're talking about housing first, we kind of have to separate our, speaking in the mic, okay. When we're talking about housing first, it can be hard to separate our moral judgments as to who deserves to be helped and our kind of business judgment as to what approach is going to give us the greatest cost savings across the systems so that we have more money left to help other populations. And it's, I'm not the expert in this area, there are other people here, but my understanding is the housing first model pencils out very, very well. Whether they deserve to be helped or not, putting them in housing saves a lot of money in all of the systems. So that's why I would support that.
I agree with Mark's priorities on who in general to support in our organization focuses on mothers and their children first before most everyone else. But we were called here to deal with the problem on the streets, which includes youth and also includes adults. And whether or not we agree with whether the individuals we're talking about have chosen to be drug addicts or alcoholics or to abuse alcohol, or whether they've gotten into a situation they cannot get out of. We had briefings that took us beyond this subject and talked about homelessness in general. In some cases, those issues got wound into what's here, but our task here was to look at what we could do to reduce the problem on the streets. And either, as Julie mentioned, we don't have any at this time, and so we do have individuals doing that kind of model, but they're doing it without the house, and so they're without the shelter, and so they're doing it on the streets. So I would be in favor of more or some housing first.
Glenn, and then Ken.
My youngest sister is on psychotropic drugs, and she lives in a house with 3 other women. It's a 4-bedroom house. This is in Seattle. And they have a system, and so she's on a Social Security disability, and she pays, her share is $248 a month. That said, the reason I'm a proponent for housing is that if this wasn't available to her, she'd be pulling a roller bag around Seattle. And I'm not trying to come up with housing up in Everett to bring her up here. She doesn't want to be up here. She likes Seattle. But my point is, again, if she didn't have this place to go, and if she didn't pay her rent, I'm responsible for that. She'd be pulling a roller bag around Seattle, and that's exactly what I think we're trying to accomplish here.
Can I clarify? I have no problem with that. My concern, at least the way I understood the presentation from Seattle, is I thought he said 250 square foot apartment for a single person. Now, what I was trying to explain is, when you go to college, you're in a dorm room, a small little room with 2 people. I don't think you necessarily have to have a 250 square foot apartment for each individual.
You are exactly right. Anything, 100 feet is enough. Again, I mentioned it before. Let's don't go the way with Seattle on this housing, but let's come up with housing.
So that there's 2 things being conflated here slightly, which is, one is the housing first model, which is unrestricted access to shelter, and then 65 is the type of shelter to which they may be accessed, which is sort of the lower cost models. But I think you had other issues as well there, Mike. Ken.
So I was actually going to speak to that. I mean, 62 and 65 in my mind could be combined. Clearly, housing first model is a good model. And whether they are called housing first or not, there are a number of housing first housing units in Snohomish County. They're just not called that. And so I do believe we need to have an expanded housing first model, but I also believe we need to have alternative models that are cheaper than $250,000 to $350,000 per unit. That is not affordable if we're trying to get people off the streets into a safe, healthy environment to live in. We need to be looking at different types of models, different types of housing, And also using a philosophy of housing first can be done within those different models, whether it's the very expensive housing or whether it's the lower cost housing.
So if you were a task force member, you might be moving that.
If I were a task force member other than a bureaucrat, yes, I would.
Moving that, item 62 and 65 be combined, so it's like expand use of housing model primarily through exploring the use of lower cost construction alternatives.
Can we add the philosophy of housing first? I think it's important to have that language in there and not be, so we all understand what that is. So I like the philosophy of a housing first model. I would support that, combining the two.
So you support combining the two. Folks understand what we're going to do now? We're going to combine 62 and 65. Megan?
So the important language to include would be non-barrier
Yeah.
restrictive housing.
So you want to move it to, instead of unrestricted access is not good?
Low barriers probably more.
Low barrier, it should say, in item 62, it says allow unrestricted access to, and now the vote is housing. Is that okay? Or is that, it needs to change? Do you want to make a further friendly amendment to that, or low barrier, zero?
You want to say low barrier instead of
I just really want housing first in
Okay.
there.
Okay.
As a concept, because that's pretty universal in our understanding that it's
We can worry
low or
about that later.
non-barrier, and it's for the chronically homeless, the people who are at most risk of not going into traditional services or shelters. So it really is addressing what we're doing today. So I just want to make sure that's.
Okay, so we can have low barrier in that, in there? Okay, low barrier goes in. Is there any other discussion? I'd like to keep us moving here. Craig?
Could you repeat the motion?
Yes, the train is making it hard to hear too. I believe the motion now says, it relates to items 62 and 65, and it's to expand the use of the Housing First model, allowing low barrier access to housing for chronically homeless individuals after which they can begin to get treatment, and explore implementing this model through support for efforts by the county and others to develop low cost, et cetera, all the items that are in number 65 as written. Okay? That's the motion. Does that, people understand the motion now? People there? All right, people ready to vote on it? That would be really nice. Okay. Was second? Good, thank you. I thought we had one, but I could be totally wrong at this point. All right, who's in favor of this item? So I'm seeing 22. 22. 22, okay, they get combined and they move to green status. All right, I think that gets us through category 3, and now we are, unless I'm open. Bob, is your card up for a thing? Okay, category 4, improving public understanding. You had some, I think you had some good ones in here. There was only 4 of these, and the one that was rejected had to do with the false perception that legalization of pot is associated with an increase in homelessness. So, I didn't have anything in particular to talk about with this category. Did any folks have some discussion on this one? Renee?
Number 67, it's very similar to the BOSS program that we just moved up. I thought it was a duplication, actually, but I don't know that it really matters, and I'm not making a motion. But.
Okay, yeah, you know, we were actually talking about that earlier. I think the BOSS program requires a city staff person, and the business community liaison to service providers and vice versa may not necessarily require a city staff person. It might be the business community finds its own liaison and the service community finds a liaison as a point person. Or you could decide to implement it a different way. But there's no motion associated with that. Is there any other motions associated with category 4? We're going to call category 4 good then. Let's go to category 5. This is interagency coordination and communication. And again, you have a couple of really strong recommendations here. The thing we talked about early on, mapping resources, increasing coordination, engaging cities elsewhere in the county to do their part. We have also recommendations around additional sort of brownie points for good collaboration, helping you get additional funds. Systems analysis of these issues speaks to many of Ed's comments and others. And then inviting members of this task force to join the Snohomish County Partnership to End Homelessness Board. So there were some other sort of systems-related stuff that didn't make the cut, but I think the main points, I think were well covered. I had, other than the fact that I thought 78 was very similar to 75 in some ways, I had no particular sense of internal conflict with the votes here. So I would ask if folks had wanted to discuss any of these items. Okay, we're calling this good. Now we're down to advocacy, and I'm pretty sure we're going to want to be talking about item 85 based on our prior discussion. And I think my only comments for you on this was that I was somewhat surprised about the lack of support for items 85 and 86, given the other general points of discussion that we've had here. So, are there any items to discuss in category 6, which is sort of the catch-all category, primarily targeting advocacy? Renee, thank you.
I'm sorry, but before we move on, I'd like to discuss number 80. Form a council to meet regularly to coordinate, streamline, identify priorities, compare notes, and assess progress on task force recommendations. And I just found it ironic that the mayor's letter today recommended that kind of a committee, but the percentage of passing is 21%, and I just wanted to make note of that and bring that to light, because it's kind of contradictory.
Yeah, I think that, so this would be you could call this a permanent, I could see how this could be read as inconsistent. I don't know whether you want to talk about that. I think, so the approach that we have is a small implementation group reporting back to you as a whole. That's sort of the approach that the mayor has put on the table and has been discussed with the co-chairs, which so. Have at it.
The only difference I saw was that 80 kind of sounds like one more permanent council existing out there, whereas the mayor's proposal was a much more compressed and focused group with marching orders to come up with a plan to get as many of these as possible moving forward, not necessarily creating a permanent standing council. So,
Time limited.
yeah, exactly.
Amen. I think there ought to be a rule that you have to kill off one committee when you create a new one. That's a statement against interest, but I believe it. Okay, but that's, so maybe a little clarification there, but arguably a conflict there. Yeah, thank you. Other comments? Bob?
There's some question, is it possible without creating a new standing committee to say that this task force would adjourn once every 6 months to review the status and progress of, and just limit it to, or have it be those of us or agencies that have participated in this?
So I think that's a really good question. One of the things we want to get into is the follow-on, and you could make it a motion that the task force would recommend that it be reconvened every 6 months and the mayor's offered to do that, but whether or not you say we would like to do that is and put that in your report is something that you could do.
I'd just like to hear Craig's views. I know Craig has been particularly concerned about implementation and making sure this moves forward as we go on. So I'm curious what Craig would think about this item and the discussion we're having.
The one to reconvene every 6 months?
Well, that or permanent council or...
Permanent council. Okay. Craig, have at it.
I wish I could hear. I'm sorry. You'll have to repeat your statement.
I just was curious what your views are on having some kind of council to monitor this as opposed to the other things being discussed, which the mayor's implementation group, which is going to happen, or the reporting back to this group every 6 months for some indefinite period of time. They seem very similar to me, but I know you've got views on this.
I do. Well, I was waiting until we got to the portion where we talked about the prioritization.
Okay.
And I'd be happy to address that then, but I can do it now, and I will. Looking at all of these recommendations, I'm a big believer in the 80-20 rule, that you should be focusing 80% of your time on things that you can control or significantly control. 20% of your time should be focused on things that are kind of out of your control. And I think we as a task force should identify things that are within the city's control, and those things should be implemented by the mayor, not by a committee or a subcommittee. The mayor needs to take responsibility for that. And believe me, when the mayor calls me, I treat that differently than if I get called by someone else. And I think that's true with everyone in the community. There's no substitute for an active, engaged mayor, and I think that's what we need. And no disrespect to you, David, you're a very capable person. But I think we need that, absolutely.
Okay, so I think that's a good comment, and we will be talking a little bit more about where we go from here. So my question is whether or not you wanted to have a motion around recommending that you be reconvened, or do you want to defer that discussion to that other time? We can do it. We're almost done here.
I'm just, if there doesn't appear to be other interest in it, then maybe it'd be a waste of time, so.
Yeah, I mean, if you guys don't want to come back, that's a real thing.
There's a.
Ken?
I was just going to suggest that we're really, really close to getting Category 6 done, and it's 22.6. And I was thinking maybe we could defer that, Bob, because I think the committee, once you get through the Category 6s, you're going to be talking about next steps, and I would see that as part of next steps.
That's fine. Thank you. Oh, Glenn's time went down. Okay, are there any motions, for example, around items 85 or 86? Megan?
Okay, I tried to write this down and carefully word this.
Okay.
So replacing 85 and revoting on it with this wording. Support increased funding for mental health, drug and alcohol treatment through the advocacy of state, local, federal, and private funding.
Through advocacy with state, local, and private funders?
Yes. Local, state, federal, and private. That covers what Bob said. Right.
Okay, so it's basically taking that, adding clarity that we're targeting, we're going after the state, local, federal, and private funders, and we're asking all of them to support their support for mental health treatment, drug and alcohol treatment funding. That's the motion. Not terribly elegantly worded by me just there. Okay, are there any questions? Is there a second on that motion? Second. Thank you, Matthew. Is there any further discussion? All right, we're ready to vote on this one then. Ready? All in favor of number 85 as amended? I'm seeing 23 straight up. Okay, thank you. Unanimous, goes to green. Thank you, Megan. Anything else? The one was the most expensive piles of recommendations we have here are around building new housing. So it was a curiosity to me that we wouldn't ask the legislature for some help there, but that was just my point. Alan?
This is just an observation, and as much as I enjoy 83, I don't know how we can control that.
No.
I think it becomes an advocacy thing. There you can.
It's not worded as advocacy. So
That's
I'm
true.
just saying.
This was number 83. The question of government funding should be more flexible so agencies can apply it where needed and spend less time reporting back to the state and federal government. You supported that recommendation. And so the question is whether there should be modification to that. Are you making a motion? No, you're just raising an observation. Okay, Tom, you had your card up?
Yeah, being aware that there are likely dollars going to be available through the State Housing Trust Fund, I would like to suggest a motion on 86 to advocate the legislature to increase money in the State Housing Trust Fund to support specific housing projects addressing street-level social issues in Everett.
Thank you. So you're asking for a revote on item 86. Is there a second?
Second.
Thank you. Is there discussion? All right, guys, ready to vote on this one? I'm sorry, there was discussion?
Well, along with that, just one added item to, it's a good motion, but everybody in this room and your neighbors and friends need to be called upon to take a visit down to Olympia to follow up with that advocacy. Just sending one lobbyist isn't going to work. They need to see real faces. I'm just saying, so.
Good observation. Okay, I think we're ready to vote on this one. You guys are doing great. All in favor of 86 as written? I'm seeing unanimous. I'm seeing 20. Actually, I'm seeing 22. No, Julie's fingers up. Okay, 23. Thank you. Any other questions or concerns about Category 6? Motions to amend anything in Category 6? Hearing or seeing none, the marathon session is concluded. Thank you all very much. Nicely done. We got through 93 items. Okay, 14 adjustments. So we will, don't leave yet, we will redo this ballot, and we'll present it next time so that it reflects the adjustments, and that will be an exhibit to your final report. So with a couple of minutes, thank you again very much. That is hard work to get through all of that, but I think it was a good discussion. I appreciate everybody's attention and willingness to talk through stuff together. So the last couple of things we wanted to talk about here were the plan for, well, suggestions for prioritizing and consolidating recommendations. And Craig has offered that we need to be really clear about what our priorities are, and we have a lot of issues on the table. We have more issues on the table now than we did. And we know there's going to be some sort of at least the mayor's offered said he will convene a small group that will develop an implementation plan and report back to us on what that is based on your recommendations. So at a minimum, what I will be doing between now and the next meeting is taking all of your recommendations and trying to consolidate them under a much smaller number of sort of thematic areas or strategic areas. And so the individual items will all be there, they'll be captured, but they'll be grouped together so that it will be easier for somebody to sort of grasp it. There'll be a focused, somewhere 12 to 18, hopefully, different types of strategies and with groups of ideas. And I'm going to build, however, off of these same 6 categories that we've been working from. So you might find, 4 or 5 ideas in this one with sub-ideas and so on. So I'm going to keep this because we're familiar with this. I think it's a pretty logical way of separating out these things. And I'm going to give it my best shot, and I'll share it with the staff team and the co-chairs. And with their input, we will, at a minimum, we'll give that to you at the next meeting, and then you can decide if it works for you or if it doesn't, and you may want to decide to call out a couple, 3, 5 priorities, issues as the ones that you want really, even though we have, 50 things that we think are important, we should be moving on, we may go through an effort to try to identify the top X, less than 5 or no more than 7 ideas that you really want people to focus on. Ken?
I was just going to comment to not want to lose sight of what Bob was talking about earlier relative to, does this task force agree that they would like to be brought together maybe twice a year to be provided with a progress report or not?
And I'll just say, as facilitator person, I think this is being willing to come back, even if it's just once a year. If you're willing to come back for a couple hours twice a year, it's an incredibly powerful tool to bring pressure to those who are being asked to implement to show progress. So in my experience, that is agreeing to come back or asking to come back is the most effective accountability tool you can put in place. So I would just offer that. Mark?
Yeah, I'd agree with that, Karen, and I guess given the late hour and where we're heading with this, I think that's a really good topic to focus on when the mayor's here. Because, there's a lot of work that David and the mayor will do to get this in shape, and then, an accountability mechanism could be folks that are interested from this group, so.
So I think when we do get the mayor here, it would be good to have our ducks in a row to say, whether or not you as a group are willing to reconvene, or whether only some of you are willing to reconvene, as an example. There will be other things we're going to get our ducks in a row on in terms of our priority recommendations and how we want to talk about these things. So we don't have to vote on that today, but I think we should think about that issue and decide on that. Other thoughts about prioritizing, consolidating recommendations, and/or the plan for accountability follow-up? Okay, well, we're going to come back with some more ideas for you to react to. And then in terms of the last thing, because everybody's brains are slowly melting here, mine's probably already melted because I'm still on East Coast time. Communication rollout ideas, just be thinking, sorry.
Well, just in terms of how we present that, I was wondering if we could defer that conversation to the next meeting, because I think that plays into exactly the same topics and how we present it.
So we'll come back to, at the next meeting, in the outline, there will be some points around that I'll now just make them up. Ta-da, and you'll get a chance to take a look at them as co-chairs. There will be points in there around items D and E, follow-up accountability and communication rollout ideas, and it will also incorporate my suggestions for at least consolidating recommendations, and I'll think of a process for us to work through about how do we identify some that we might want to call out as priority items. So I'll leave it at that then for today, and I think that's good because everybody's exhausted. It takes a lot of energy to stay focused on that discussion for as long as they're on. Alan?
I mean, would it be possible for the motions that we have in the positive, would it be possible to have that spreadsheet emailed out to all of us before the next meeting?
Yes.
Then maybe even us take some time to prioritize on our level so that when we come back to the next meeting, rather than starting at 0, we might actually have our own top list of something that we could begin to discuss.
Do you want me to send out a ballot? Is that sort of like a homework thing, or do you just want to informally think amongst yourselves?
It's a ballot.
I would do a ballot myself.
An additional ballot?
Well, just on the ones that we have already, I mean, the ones that did not make the cut, they are not on it. But then we would take the ones so that we don't need to worry about agreeance on. We might just prioritize on, like, if number 1 through whatever I don't want to go 1 through 90 or how many there are, but what our top 10 might be.
Go ahead.
I guess one thing I would throw out there is the discussion of prioritization is pretty complicated. I wouldn't want to just have us all do it on our own on a ballot, because what it will be is our list of top 10 favorites, whereas prioritization should involve things like how quickly they can be implemented, whether there is a party that can take the lead right now to implement it, whether there's funding, but whatever factors, it'd be different probably for different people, but there are complex factors that would go into creating a prioritization other than I like this one best, I like this one best. That's just my thought.
I think we may be a little hard pressed to get the whole ballot rolled together, for a second ballot put together and shipped for folks on all 60 items that we have consensus around too. So I like the idea very much of getting you guys the cleaned up ballot as soon as we can, the amended ballot, and having everybody give some thought about strategic priorities that you think we ought to recommend as the most important changes, the most important action steps that you think will make the biggest difference in the community, and give some thought to that before you come back. And maybe, I'm sorry, Alan?
No, so then on that returned spreadsheet, can you also re-include the number, the money sign, the other factors that aren't included on this, so that we can begin to recognize where
and the
potential money and agencies, or the original
and the
spreadsheet.
timeline,
Yeah.
how long it takes to do it.
We can do that. We'll probably have to drop the final ratings category, the fund, but we'll have it in by, I think we can do that. Okay, we can do that. So then the homework is to look at the revised ballot and think about what you might want to call out as your, we'll just say 5 for good measure. And the 5 most important things you think this group is recommending, and we can get into that discussion at the next meeting. Okay? Thank you all very, very much. It's so great that everybody was here today. That makes a huge difference. And for the support in taking the time to fill out the ballot, very much appreciated. You guys have been just amazing. So thank you very much. Bob, a good of the order comment here?
You may have solved it when you said only 5, because if it is for us to go through and reprioritize the whole list, we've already done that.
Not going to do that. No. We're not doing that again, just so it'll be, okay? And maybe our co-chairs will have a straw man set of nominations.
All right.
Thank you all.
Boy, I'll tell you, yeah.